Welcome to the Who Cares podcast. My name's Laura Travers. I'm from the Devon Alliance for International Recruitment. Today we're going to be talking about vaccinations in a bit more detail for the migrant care, not just care workers that we bring into the UK. It could be nurses, AHPs, doctors, anybody that's coming to work in the UK from a different country. We're talking about vaccinations and what's available to them. So with me today I've got the ladies from the vaccinations team within NHS Devon and Torbay as well.
Hello everyone.
Hi there.
Hi.
Hi. And I've got Geoffrey as well from the Devon Care Homes Collaborative.
Hi. Yep, indeed.
Nice to have you here today. Thank you for
Welcome.
joining us.
Thank you. My pleasure.
So we're going to talk about vaccinations in a bit more detail. So what have you got to tell me?
So I think it's just to reiterate that it's really important that anybody that comes over to work in the UK or is a asylum seeker, refugee, that it's really important that you register with a GP. Everybody in England is entitled to register for free, and you do not need to have proof of ID or immigration status to be able to get a GP. Even if you have good health, it's really important that you may need support in the future.
Okay.
And the GP surgeries are there to support you with your vaccine schedules.
I didn't realise that it was regardless of immigration status. So even if you are not in the UK legally, potentially, you can still register with a GP.
Absolutely, really, really important.
I didn't know.
No, I didn't know that. That's great to know.
News to me.
Yeah. Okay.
Useful bit of learning. Thank you.
And Geoffrey, when you get your care workers that come to work in the UK, do you say it's quite important to them to register at a GP surgery?
Well, I have to confess, so we haven't been doing so.
No.
Most of the people who we've recruited are nurses.
Yeah.
Nurses in their own country, not necessarily here
Yeah.
recognised yet, but most of them are seeking their PIN numbers as soon as they can. But
Yeah.
it can take from a year to two.
Of course.
Most of them are here with their families, and the husbands are coming over. So most of them are women, not all women, some men. Bring their wives over as well.
Of course.
I know that they're pretty much very rarely registered with GPs because they've got families, young families, they're all at school, and they're looking to settle and be part of the community and progress their careers here. So they're very excited about being here. So I don't perceive any reluctance or resistance at all, like the reverse probably.
Yeah.
They're an amazing group of people.
I suppose it would be easier to register for a GP online than having to go in, because at my doctor's surgery you have to fill out a physical form, but I found another surgery that I registered my partner at and he could do it all online. So I suppose it would be a lot easier if you could actually just do it online for a GP surgery rather than having to walk in and fill out the forms. That would probably be easier for them.
Yeah, well, they have been doing, or whatever they've been doing, I don't know, but it's not been having a problem, I know that much.
Good.
So they're on the ball.
That's
Very
really
much
good
wanting
to
to
hear.
integrate and not hang around,
No.
hide in the shadows, anything like that. They're
Definitely
very
not.
much, very settled very quickly, which is quite remarkable, and perhaps not what I anticipated.
Oh, it's great to hear.
Yeah.
So they're registered with the GP. So would the GP then approach them and say, let's talk about your vaccinations, what have you had?
Usually you would get a first visit appointment where you would go to your GP surgery and they'll be doing your blood pressure, for example. They would ask you some health questions so that they have some baseline information when you become registered with them. Usually they invite you once all of your NHS number has come through, and then they're able to record this information and discuss with you about your vaccination status. And also for their children as well. We just have to remember that in some countries they have a different vaccine schedule than ourselves. So the nurse or the doctor will be able to go through our current schedule and see if they're missing any vaccines that we're able to offer them or their children to protect them from any preventable diseases.
And these are all free of charge, not just for their children but their partners as well, their whole family.
Absolutely, anybody that's in the UK is in England is entitled to those vaccinations for free.
Great. So what does a full from birth vaccination schedule look like?
So we start vaccinating so quite young. So
Yeah.
the routine schedule usually starts at 8 weeks. So babies come along at 8 weeks old, 12 weeks old, 16 weeks old, and then they come back at 1 year old. And have another set of vaccines, and then we'll invite them back at preschool age, so 3 years old and 4 months, and they'll have some booster vaccinations then, such as the MMR, for example. So there's some really, really important vaccines. All of them are important, but it's just important to make sure that you keep up with the schedule. Majority of the vaccines you're able to catch up on. So some are time limited, but the majority of them, especially for children, if you miss an appointment, you can catch up, and the GP surgeries will work really hard in making sure that the children get the full protection. In that time, they'll also be offered annual flu from the age of 2 years old as well. And then when they go into a school environment, the school immunisation team will actually come into the school, and parents will receive an email to fill out consent, and they will get offered their flu vaccinations at school. And then in secondary school, there's some other vaccinations, such as the HPV vaccination, which is the human papilloma vaccine, which is offered to boys and girls, and it reduces chances of cancer, such as cervical, genitalia, and head and neck cancers. And then a year later, meningitis, ACWY, and also a booster vaccination for diphtheria, tetanus, and polio. And also the school age immunisation team do catch up with the measles, mumps and rubella vaccines as well. So for some people, they may have missed one appointment, but it's just really important that you have 2 of those vaccinations to get you fully protected from those diseases. And adults can also catch up with those.
Great.
But all adults up to the age of 25 years old, for females, up to 25, they're entitled to the HPV vaccine. For boys, as long as they were born after the 1st of September 2006, they're also entitled to the HPV vaccination, and that's the one that protects them from those cancers, genitalia cancers and cervical cancers. But they're also the meningitis vaccine. They will also be offered up until they're 25 years old.
That's interesting. So what if a migrant worker is coming from a country where TB is quite prevalent? What would you suggest?
So they're coming from a country with high prevalence of TB, if they have a baby, then we would be looking at the BCG vaccination, which would protect that baby going forward. So we would encourage them to have that vaccination as part of it. I don't know if you want to talk about any
so
of the parts.
the BCG vaccination is now offered at birth. Back in our day, certainly when I was at school, I had the vaccination in my teens.
I've still got the scar.
Yes, absolutely, and that scar's really important. Actually, it's really important. That's the way the vaccination is given. It's an intradermal vaccination, and that scar actually shows and proves to us that we've had the vaccine. Babies born to a parent or grandparent who's lived in a country that has high TB rates is offered routinely the vaccination, and that invitation should come through and be discussed with your midwife and after the baby is born, and within a couple of weeks of the baby being born they should ideally have their vaccination, but all of that advice will be able to be sought through the midwife, but really important that you do get to those appointments if you are booked in for those, if you have been advised. And then I believe that there is the GP surgeries will certainly ask if you've come in as an adult or a teenager, whether or not you've had your vaccinations abroad, because obviously there are vaccine schedules in other countries as well, so hopefully they'll have had them. But I know that there is an awareness of latent TB and just making sure that everybody is getting protected.
So I'm going to ask a couple of questions from the care home collaborative point of view, and I obviously look through the lens as a nursing home provider with migrant staff too. There was obviously, because it became compulsory, a big push to get COVID vaccinations at the time. That was quite a scary kind of moment. Some people, one or two were opposed. There's lots of disinformation going around, but we pushed through and managed to get 100%. Strike rate. I think we lost one member of staff who was absolutely not going to. But so that was good. But then the law changed, and now the compliance rate is not so high, if I can call it compliance. And we have the same annual kind of conversations. I'm sure I speak for everybody. I don't think we're particularly different around the flu vaccine. Some people will, and some people can't be bothered, and some people are diametrically opposed. So, what's the kind of latest thinking about COVID and flu, and are the migrant workforce more reluctant or less reluctant, or what's the kind of strike rate you see? in either side of the
I think
population?
it could be really mixed out there. So I've certainly been to care homes, and actually the migrant health workers did come forward and have their vaccinations, and it was really good. And some of them had been having their COVID vaccines in their home country before they had moved to England, you know, they are still there, I think, considering to protect themselves, to make sure that they're not off sick as much, because if you have the vaccines, COVID and flu, you're less likely to get severe COVID. As we're moving along, COVID is changing, and we are finding that the healthier population may just be unwell for shorter periods of time, but as healthcare workers, we are still recommending that they get their vaccines. So they may not be as poorly as we used to find previously, any healthcare workers, but it's important just to make sure that you're able to get up and go to work and protect your residents and patients as well. I think flu, we've certainly seen in the media recently that the flu rates have gone really high and increase in hospitalisation. I think there is always a mixture, and I think sometimes for migrant health workers it might be accessibility, finding out where they can get their vaccines, and it's just understanding that as healthcare workers there may be an occupational offer in place for flu, but the vaccine centres in Exeter, in Plymouth and in the north do offer vaccinations, and at the ERC as well do offer the COVID and flu vaccines to healthcare workers, and all pharmacies as well. If you take your ID along or tell them that you're a healthcare worker, you should be able to get your vaccine.
So where is it easier? Because whatever period of time you're in and whatever type of vaccination you're seeking, there are sometimes obstacles, or you can't have this, or you're not on this list, or you haven't made an appointment. So the vaccination centres, is that kind of like foolproof? You can walk in, get a vaccination. Is it that simple, or is it not so simple?
The majority of the time they're able to take in walk-ins.
Right.
You can book through the national booking system, so that gives you a guaranteed appointment, and the vaccine centres do usually work at quite a high pace, so they do expect large numbers to come through, and they very seldom have to turn anybody away. So
Right. Okay.
sometimes some of the outreach sites, so they go to lots of different locations. They want to be able to go to locations where people may find accessibility for vaccines a bit harder, and sometimes they can be quite busy, and obviously if there's any booked appointments for those outreach, then they would take a priority if they only bought a certain amount of vaccine with them, but they would always be back if it was a very busy clinic. They obviously don't want elderly standing out in the cold for long periods of time, but they would always revisit if they found that they were overwhelmed with
High uptake area.
a high uptake. Yeah, absolutely. But they are used to people walking in, and they are really supportive in getting.
So would that be
vaccinated.
any vaccination?
That's just currently COVID and flu
Okay.
at the vaccination
So
sites.
otherwise back to the GP then, really?
It's back to your GP for vaccinations such as diphtheria, tetanus and polio. That's
Yes.
one vaccine, but protects against those three diseases.
Yes.
And also for your catch-up HPV vaccination. That's if you're over the age of 16 and you've left school. The GP surgeries can catch up with your HPV, your meningitis ACWY until you're 25, and anybody of any age can catch up on their MMR vaccine as well at their GP surgery.
Is it still a bit patchy with one GP practice to another, or how available or accessible vaccinations
No,
are
all
in general?
vaccinations
They should
are
all be,
available at all GP surgeries.
in theory.
Yes, absolutely.
mean,
I know, obviously, sometimes it can take a little while getting an appointment, and
Yeah.
you just have to appreciate that it can be very busy in the winter. But
They
these
can.
vaccinations, such as diphtheria, tetanus, polio,
So
HPV, that's all year round you can access those vaccines.
Mhm.
We're not just looking at winter, which is similar to the COVID and flu. There's a certain period of time you can get your COVID and flu, and then that offer will stop until the next seasonal offer.
All right. Okay.
Holly, what would you say to somebody that might be a bit hesitant to have their vaccines coming as a migrant worker?
I think it's just really important to speak to a healthcare professional or ask for support in accessing the vaccine information in your own language through an NHS approved website.
Okay.
It's just make sure you don't go to social media. There's a lot of misinformation, and even practice nurses at GP surgery. If you decide you, for example, want to take yourself or your children to have a vaccination, but you're not sure about the vaccination, you can book your appointment, but they are not always expecting you to take up that vaccine on that
You're not
day if you
obliged.
want to have a conversation.
And
Some
you can
people
take,
may want
like,
to just discuss it.
printouts. Yeah. And there's a lot of information, isn't there, through the doctor's surgery as well, where you can take away leaflets and things like that. But we would encourage people, if they were going to look up information, to look through the specific NHS website for the information about the vaccinations.
Absolutely.
Yeah.
Go to a trusted source.
Yes, definitely. Geoffrey, did you know that the vaccinations were free, not just for the migrants, but also their families as well?
I had it as an impression, but I wasn't sure.
I think it's really good.
Yeah, it is very good. It is. I had a question. So, to what extent? I mean, I think there are people who are very happy. The majority. There'll be some who are absolutely nowhere. As I said before, there are a few who are hesitating. To what extent do you think, thinking in terms of care homes, domiciliary care agencies, the employer should be more active in relation to progress on vaccination? Because I have to say, we got very active over COVID. We had to, we wanted, but we were active before that. Ditto with regards to flu, but the rules were slightly different. Other things I've never really strayed into, to be honest with you. Do you think we should?
I think it's a really important way of actually supporting your migrant population, because you are trusted to them. So it's really important that you can champion and promote vaccinations and signpost. Signposting is really important. When people don't know necessarily where to go, if you've got the information, and at NHS Devon, at the vaccination optimisation team, and also the vaccine centre staff, we do education as well, and we can come along and do vaccine confidence conversations to a group of workers. That's never a problem. We can discuss all the different vaccines and answer questions. We could hold webinars if it's easier through Teams, but we are there to support, and support the yourself.
Yeah.
Sorry, I've lost my words there.
Employers,
Yeah, absolutely. So just reach out to us.
Do you think is there a kind of on the website some available information that'd be easy to download to say, look, this is how it works. This is the situation. Really straightforward. We're interested. We're encouraging you to do this. Let us know if you have or you haven't, or speak to a manager. Is there somewhere, without putting the trouble of trying to organise people to come to a webinar?
Yes.
Gosh, how would we do that? They're either working or at home. I've no idea where they are. So that's going to be quite a process. Like training is,
So
it takes a long time.
leaflets.
But I have a lot of goes at it. But is there something that in one place, a piece of paper or A4?
If I can add into it as
Yep.
well, we have created immunization resources for international migrant workers, and we placed them. We worked with John Powell in partnership with John Powell, and we placed those resources into Infra 360 for healthcare providers to get those resources and use them to sort of like to use them in your places to inform and educate your staff about the vaccination as well.
So, I mean, this is quite timely because it links it. So here we're going into a new year next year, and we're what's really critical to us is that we are a conscientious employer looking after our people, and we're always asking the question, what next? What else can we do? And this is another area that we hadn't strayed into, to be honest with you. So I think we should, and we could, as in part parcel of the same process. So I need more information, to be honest.
Definitely. So
I'm not as
I would
au fait as
encourage
I
you
should
to
be.
have a look at the Infra 360 and that page, immunization.
Where's that? That's on.
It's Infra 360. That's the name of the website.
Oh right, okay, yeah, I get it. Okay, thank you.
Would you also be in a position to say go to a care home as such and set up an immunisation clinic if there was need for that?
We're not always able to offer all vaccinations, and that's purely because each individual may have their different GP, and so the records, the point of care records, where we may check to see if a patient has all had their vaccines, we don't have access to everybody's different GP records.
Yeah.
So that would make it a little bit difficult.
Yeah.
But we are hoping in the future that options like that will be a little bit more easier to do.
That's really good. So I've listened to this podcast. I'm interested. Where can I go to find out some more information?
The NHS website, your GP surgery, And I think Aggie's the Infra
360.
Infra 360. Okay, brilliant. Thank you so much for joining us today. That was really insightful. Thank you, everybody.
Thank
Pleasure.
you.
Thank you.